Okay, Assalamualaikum warahmatullahi wabarakatuh. Introduce myself. My name is Raka Anggarda, and I'm here to present my work. Okay, the case number one, Mrs. Susan Jenkins was admitted to hospital on Sunday. She suffered from two asthma attacks last week. The patient last attack lasted about 10 minutes. The patient was playing tennis with her cousin when she had the last attack. Her cousin brought her to an asthma clinic by an ambulance. She complained about her attacks. She also complained of having difficulty breathing. Okay, this is writing a care plan. The name, patient's name, Mrs. Susan Jenkins. Reason for admission. Reason for admission. The patient suffers from asthma and shortness of breath. Symptom: extreme fatigue, shortness of breath. Action to be taken: spirometry, airway function test, peak flow meter test, and nitric oxide test. Okay, case number 2. Miss Burton suffered from essential hypertension and her blood pressure ranges from 115 per 19 to 184 per 108. Her essential hypertension might be due to the narrowing of the arteries, more blood than normal, of the heart beating faster than it should. Miss Burton also had dyspepsia as a result of stroke. She found it difficult to communicate with others. Okay, this is patient's name, Mrs. Burton. Reason for admission: essential hypertension and her blood pressure range from 115 per 19 to 184 per 108. Symptoms: essential hypertension. Action to be taken: addressing decreased cardiac output and blood pressure monitoring. Admission of drugs and pharmacy support, increase activity tolerance, improving coping, and adherence to therapy regimens, promoting lifestyle and diet modification and weight loss, and the last, teaching health and increasing knowledge. Okay, case number 3. Isabel was a 3 years old soldier. She is the child of Mr. Jason and Miss Mary Donovan. Isabel was admitted to hospital on Monday. She developed chickenpox. The illness followed the normal patterns at first, but then her symptoms got worse. Doctor thought her it was all normal, but Isabel had to be rushed to the EA department of their local hospital. Okay, patient names, Isabel. Reason for admission: she went into multiple organ failure as a result of secondary infection. Symptom: developed chickenpox. And action to be taken: consume lots of fluid to prevent dehydration, and wear long pants, long sleeves, and socks to prevent children from scratching their skin. Use cooling cream or gel from the pharmacy. And the last, take a cold shower to relieve itching. Wear loose clothing with soft fabrics. Okay, thank you. Thanks for attention. Wassalamualaikum warahmatullahi wabarakatuh.